Unilateral lumbar PAIVMs are indicated if a patient has a subjective report of symptoms or pain in the lower back. You can do it to assess hypo or hypermobility as well as end feel. Contraindications include recent spinal fracture, cauda equina lesions, or neoplasm. In applying a posterior to anterior force through the transverse process of a segment, one is assessing the quantity and quality of a motion into rotation in the lumbar spine. End feel is assessed by noting pain, spasm, reproduction of symptoms, or resistance to motion. Few studies have examined the validity and reliability of accessory motion testing of the spine. However, one study found that intertester reliability was good for stiff segments and poor for identifying more mobile segments. As far as validity, PA assessment based on the level of agreement with dynamic MRI was poor.
Okay, Sandy, today I'm going to do a test called a PAIVM, and what it's going to be doing is just going to assess the motion in your lower back, and we're going to see if that motion causes any pain or reproduction of your symptoms. Okay, so just want to show you this. So this is where we're going to be looking. This would be called, if I was putting pressure right here, it would be a central PAIVM, but what I'm going to be doing is a unilateral one. So I'm going to be applying pressure just lateral to the center bone right here, and if, for example, if I pushed left, it would be seeing how well this segment rotated right. Okay, Sandy, now that we have you in this position, I want to tell you a little bit about what you might expect or feel. I'm going to be applying pressure along the left side of your lower back here, so you may feel some motion or pain. If you do feel pain or any reproduction of your symptoms, I'll consider that a positive test at that segment. Okay, so just let me know if you feel any pain or you're uncomfortable at all. So what I'm going to do now is I'm going to put my hands on your back and feel for landmarks. This is the top of your hip. So I'm going to come down a little bit and start at your lowest segment and move just to the side of that. Okay, I'm going to take up a little bit of your skin, and then any pain with that?
That was okay.
Okay. So I'll just continue to move up your spine. Just doing 2 or 3.
That one was a little painful.
Okay.
Yeah, that one hurt a little bit.
That one hurt too?
Same as the one below.
Okay.
That was okay.
It's okay? Okay, one more. Okay.
Yeah, that one was fine.
Okay, Sandy, what I found today was some pain at your 3rd and 4th lumbar segments, so I would consider that a positive test at those segments. Okay, Sandy, I just want to ask you about some contraindications before we do this test today to make sure it's safe that I do the test.
Okay.
Do you have any recent spinal fractures?
No.
A history of neoplasms or cancer?
No.
Osteoporosis?
No.
Rheumatoid arthritis?
No.
Do you have cauda equina syndrome?
Yeah, a doctor told me recently that I do have that.
Red flag! Red flag! Someone get the AED! What I found during that test.
Wait.
Hi.